Welcome, everyone, and good evening. I'm Lauren Gates, your host of this evening's Airway Health Solutions Conversation Series with our special guest, Dr. James Bronson. And tonight's topic is the Advanced Lightwire Functional Family of Appliances. So welcome, Dr. Bronson. Thank you for joining us tonight.
Thank you, Lauren. I appreciate you giving us the opportunity to talk a little bit about this appliance.
Thank you. You know, wherever I go, Dr. Kevin Boyd, Dr. Ben Moralia, they always say, you got to talk to Dr. Bronson. You got to learn from him. So there are so many questions about Lightwire appliances, the therapy. And so we're so thrilled to have you help us answer those tonight. I'm going to go ahead and give you a formal bio, if that's okay with you.
Perfect.
And
Thanks.
then you can kind of add in any other details, maybe some fun facts if you want. You can kind of think of one as I'm going through this. Dr. James Bronson is a fellow in the International Association for Orthodontics and a certified senior instructor at IAO. He is integrative dental practices dedicated to whole body dentistry in McLean and Charlottesville, Virginia, shared with his son and daughter. He is a cum laude graduate of Georgetown University School of Dentistry, a member in the ADA, the Cranial Academy, the AAGO, the IAO, the AGD, and the American Academy of Dental Sleep Medicine. He has lectured on and throughout the US, Asia, Australia, and Europe. And Dr. Bronson co-founded the AIE, the first certification institute in Lightwire appliance therapy, emphasizing the growth guidance philosophy utilizing Lightwire appliances in 2012. And he has taught over 200 healthcare professionals from around the world the importance of airway development and growth guidance in 2 to 6 year olds. So fix under 6, we're in the same bucket here. Dr. Bronson is a medical advisory member for Documenting Hope, an organization dedicated to improving the health of autistic spectrum, cerebral palsy, and other special needs children. So welcome, and we are thrilled to have you here. A couple of other facts that I've found is that you're a fellow Buteco Professionals International, and also you are a fellow in the International Association of Orthodontics. So welcome. Anything else you want to share with us?
Yeah, thanks. Yeah, just the only thing about, and we're dealing with Lightwire appliances. I just wanted to mention also that I specifically talked about our training program, which goes at the young age group, but we actually treat all ages. And we have some 70 and 80-year-olds that we've helped get through some serious issues. So it works at any age. It just, you have to look at what you're doing and learn that part of the program.
Wonderful. Well, we also want to see and extend our warm welcome to our attendees tonight. We did have about 350 registrations. A lot of people knew they wouldn't be able to attend this evening. It's a nice summer night for many people, but this will be recorded and you can access that. But let's see who's with us tonight. We're going to go ahead and take a poll and see who is joining us this evening. So let's go ahead and launch that. Okay, awesome. So we're heavy in dental this evening and speech language pathologist, myofunctional therapist. So, okay, well, welcome everyone. Our other healthcare professionals, you want to put in the chat what profession you are so we can welcome you as well. We just want to give you a kudos for taking the time to learn more and to have comprehensive care in whatever type of medical practice you are in or dental. Thank you for paying it forward in our airway health movement. I do want to do just a few disclaimers and then some housekeeping items. So the views presented are the opinions of our speaker and are not necessarily affiliated with Lauren Gates and Associates and or Airway Health Solutions. And the following webinar is provided for educational and informational purposes only and does not constitute providing medical service or professional services. The information provided should not be used for diagnosing or treating a health problem or disease, and those seeking personal medical advice should consult with a licensed physician or dentist. Always seek the advice of your doctor or other qualified health provider regarding a medical or dental condition. And then also we are thrilled to offer free CE this evening, but you need to be in attendance for the entire program. Zoom software tracks attendance, so we do not need a code or a survey. We can just run a report and you will get your CE certificate in a week or so. So give us a little leeway. We had a lot of registrants, so we're thrilled to be here. I am so thrilled to learn about this because I've heard about it. And actually, Dr. Moralia, although we really focus on his teachings, that's kind of the founding of our curriculum. But just because he doesn't do this light wire appliance therapy, but he recommends everyone learn it, and when he does, he always says, take it from Dr. James Bronson. So I am thrilled to learn from you, and thank you for your time. And I'm going to give you the floor. Why don't you go ahead and share your screen, and we'll get right to
Perfect.
it.
Thank you, Lauren. And
Thank you.
I actually have a present for everybody that sticks around to the end of the program. So,
Wonderful.
Lauren, can I minimize this one? Got it. Oh, look who's
There
there.
we go. You embarrass me.
Yeah, no, I thought this to be very, very informational, Lauren. I'm so happy that that you got the chance to have that article written about you, and congratulations.
Thank you
That's
very
real.
much.
It's really nice that you've been recognized, and I think that's great.
Thank you. And I have to thank Ann Duffy and Do Magazine. It was really an honor to be featured. So thank you for sharing that.
You're welcome. Okay, there you are again. Okay, let's go. There we go. I keep jumping back and forth here, so bear
That's
with me.
okay. We got it.
I'm a Star Wars fan, in case anybody doesn't know that. And when I talk about growth guidance and treatments that we do with all our patients, whether they be children or older, we talk about how we can awaken those life forces, how we can get them to kick in gear and do what they're supposed to be doing all the time. Our bodies have a tremendous ability. Oh, I want to talk about this particular subject. About 20 years ago, I was at a conference in Dallas with Dr. Jerry Tennant. I don't know if any of you know Dr. Jerry Tennant, but Dr. Tennant is an ophthalmologist, and he has done some really great things in the world of holistic dentistry or holistic health. And in his course, every time he has a course, and there are usually about 25 people there or more, and he asks everyone to stand up and say something about themselves. And I happened to be in the next to the last table in the groupings. And when it came to my time to say who I was or what I do, I told him that I was an elf dentist and I worked at the North Pole. And it was kind of tongue in cheek because back in those days, it was like being at the North Pole because there wasn't anybody else around that actually did light wire appliances to an extent. I mean, the inventor, Dr. Nordstrom, out in California, but here in the East, there was almost no one. I did have the privilege of meeting a couple other people. I'm going to talk about that in a minute. But so, the essence of the program, though, is enhanced vitality through facilitated tissue integration, advanced light force appliance, and growth guidance. And I'm going to elaborate on that. What I mean by that is it really is more a philosophy, a thorough protocol than it is an appliance. You could pretty much put any appliance in place and get decent results. I believe that the light force appliances probably give a better result, but that's my personal opinion. So I wanted to just say that I'm here because I stand on the shoulders of giants. And I just wanted to mention a few of those people. First and foremost was Dr. Brendan Stack, who's a pioneer in TMJ therapy. And he literally allowed me to come back and practice dentistry. I was in a car accident and I couldn't practice anymore. And Dr. Stack helped me recover from that. And I did it with a light wire functional appliance and his guidance. And I ended up spending a whole year in his office every Friday learning and being treated. And it was actually fascinating what happened there. So he's passed away now, but he was for sure one of the initial pillars in my growth. And then Gerald Smith, another dentist in the Philadelphia area, was also a light wire functional dentist, still does, and he's in his 80s today. Dennis Stroken and Gavin James, both Canadians that taught the light wire appliance. Harold Gelb, Michael's dad, he taught me a lot about kinesiology along with some other people and how it fits in. Osteopathy became a huge part of what I learned, and Dr. Tasha Terzo, my dear friend and one of my mentors, has been instrumental in teaching that. And Dr. Jim Jellis, who's passed away also, the founder of biodynamic osteopathy, a decent, unbelievable guy that we miss him greatly. Dr. Kathy Holloway, who's a DPT down in Florida, who has an institute called Neurovascular Institute. And I encourage everybody to look into her programs also. Dr. Lois Laney, she's got phenomenal stuff in neuro understanding. Dr. Richard Myron, a friend now recently, who's taught me a lot about PRF treatments and regenerative health and exosome treatments. So I'm going to touch about those things. Kathy Winslow, the first myofunctional therapist that I ever dealt with and learned from, and she's still a dear friend, and we refer lots to her. Kathy Murdoch, who her and her husband had Murdoch Laboratory, and they've been our go-to for 25 years. Dr. Nordstrom, of course, the inventor of the Lightwire appliance, and also the inventor of Orlays. I tell everybody when I talk about in my courses that in dentistry, I've learned 3 dynamically important things that have changed my life and the life of many people that we've come to work with. And those 3 things, 2 of them were invented by Dr. Nordstrom. It was the Lightwire appliance, and the other was the Orlays. And I find that we use it daily. We use them both daily, and they are tremendous adjuncts to our practice. The third one is PRF treatment and regenerative therapy for condylar regeneration and for other regenerative processes, which I learned from Dr. Rick Myron. And incredible stuff. And Mr. Yusiap Sim, who's the CEO of Graphy. It's a South Korean company that has come up with direct print aligners and some resins that we can use in the mouth. And it's changed things a lot. And we're looking very closely to how that's going to work with us in the Lightwire and in the functional appliances that we work with. This is my family, my wife in the middle, my son, my daughter-in-law, and my son, or my daughter and my son-in-law over here on the left, and these are my grandkids on the right, and my son and his wife. We have twin boys that are 4.5 years old. They were born premature, spent 7 weeks in NICU, so we've had a lot of work to do with them to get their neural systems back online and to do what they're supposed to do. So this is me, and I already got all the stuff out there. Lauren, thank you very much for putting this out. But if anybody wants to get in touch with me personally, director@quantumhealth.com will get there. Otherwise, you know the rest of the stuff here. And we have the first program to certify competency in advanced Lightwire functional practice with practitioners, and started in 2012. We have 3 levels: pediatric level, a level that is mixed dentition and adult, and then we have a complicated case level where we talk about not only spectrum children and Downs kids and TMJ issues and sleep apnea issues, and so it's a whole gambit from 2 years old to 92. And I have I'm going to try to move this up a little bit. I have a barcode here, a QR code, and this is an article that we did several years ago on tonsils that anybody can click on that and have a copy of that also. So you never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete. And I think that's what this whole Airway thing is about, not just what we're doing, but with what everybody else is doing. Ben and everyone is in the process of trying to get people to understand what Airway is about, what development is about, and how we got to get there. So what I want to talk about here, I'm going to talk a little bit about osteopathy. A.T. Still, this is one of the best books I've ever read. If you have a chance to read this book, I suggest you do. It's From Dry Bones to the Living Man. And it says, think for yourself. And these are quotes: truth and challenge truth and tradition, experts and authorities. Realize that the cells themselves have such an absolute intelligence that we just, in his words, dimly comprehend. So here we are. The tenets of our particular growth guidance philosophy are, first of all, enhancing vitality through tissue, facilitated tissue integration. And that's a little bit of the photobiomodulation. It's using the ND-YAG and the erbium-YAG. Photona is our go-to for that, the Photona laser. I have to have a disclaimer: Photona does pay me once in a while for as a sponsor for our program. So, but the reason that we use it is not because we get paid anything, but because it's the best product that's available. And we also know that our body's pre-programmed for an optimal genetic plan. What happens is that epigenetics gets in the way, and a lot of things don't work like they're supposed to, or they can't get to the level that they should be getting, or they're not getting the signalings that they should get. So our goal is to find out what those signals are, where they are, and what's not being transmitted like it should be. We also realize, and everyone pretty much at this point says and understands, that the body has this inherent ability to heal itself. Just sometimes it needs a push, it needs a little bit of extra help. When we cut ourselves, it heals. So there are a lot of things we can do that will heal once the body has the ability to do so, or it's in the adaptive capacity that can happen. So we talk about identifying, removing, or shoring up obstacles to growth and development and repair if it's in older age groups. So you do that by providing available energy. It's free energy so that we can get proper growth and development. So that's the basis of our philosophy. We look at these things and look how to fix with those. We're going to go follow that. We also talk about quantum coherence, air, water, nutrition, microbiomes. They all come into plans. And when we're doing treatment plans for patients, these are all included in the things we're teaching, because they need to understand that they have to take ownership for where their body is, and they have to take ownership for the things that are problems. And that means that our poor air water, or our poor water qualities and nutritional microbiome that's so messed up from all the things that are out there, the roundups and the GMOs and the things that don't work for us like they should. And that early prevention is preconception education. Early prevention is in utero help. So if mom and dad have sleep apnea, and mom has a fetus in utero, that fetus is being exposed to those apneic events every single night or every single time. So it becomes accustomed to having it in a hypoxic environment. So when it's born, it's expecting that environment. And so we have to get moms and dads healthy even before conception, and definitely during the development. And it's osteopathy, it's chiropractic, it's myofunctional therapy. We got to get the systems to all work. And the only way we can get them to work is by making sure that they're at their optimum level. So growth guidance, and what do we know? Well, unfortunately, it is like that iceberg right there. Most of the things that we don't know, we're learning. And that's why we're doing courses like this. That's why we're doing our best to help people understand that there are a lot of things you can do, that we can work into, and can make things better for people. So here we go again in early intervention. If the mother's stressed or anxious while she's pregnant, her child is more likely to have a range of problems such as symptoms of anxiety, depression, attention deficit, hyperactivity, slower at learning, even at allowing postnatal influences. So this is from a prenatal stress and neurodevelopment article back in November of 2009. So we know that we need to get into early development in a sense, and early interventions. Got to get the moms healthy. We got to get rid of the anxiety. We got to get rid of the depression. We got to get rid of the apnea. And for the dads too. Now, this is one of my grandsons, and he's in NICU. He spent 7 weeks in NICU. Both of them did. They're twins. And we had Dr. Kathy Holloway came and actually did treatment for him in the NICU. She's a DPT. There's Neurovascular Institute, and what she's doing here is helping him he's on an NG tube, so he couldn't nurse, he couldn't really swallow well, but she's helping him balance the gastric tube and the mandible and the hyoid and the clavicle and the cranium, and bringing them all together for him while he's still early in NICU. So this is a barrel that we developed that kind of shows all the things that go wrong or can go wrong. And when you start adding these things up, whether it be epigenetic factors, genetic factors, or birth trauma, or structural defects, or nursing defects, or latching problems, nutrition problems, medications and vaccinations, that's stress on the body, and eventually it reaches a point where the repair and regenerative possibilities are deeply compromised. We end up with brainstem survival mode issues. We end up with compromised growth and development. We end up with immunity compromised. We end up with failure to thrive or sleep disordered breathing and chronic diseases. So we need to inhibit that development of stress as early as possible and minimize these insults that the body's receiving. And so when we talk with the patients, when we're doing our interviews, we call our consults interviews, because they really are interviews, because we want to know what the parents need or what the child needs, or what the issues are and where they came from. And so we need to know how far back that we have to go to get the development to become a full and complete recovery. So what goes wrong? Well, we already talked about the pre-programmed optimum genetic plan and epigenetics getting in the way. It's kind of the beauty and the curse of epigenetics is that the cell signaling factors are provided, but sometimes they don't get through. And sometimes things get in the way. I don't know if you've ever seen this article. It was a Western Dental Journal of 1909. It was written by Dr. Henry Ferris, and it's titled "Is Your Face Beautiful?" And he goes on to explain how if you look at all the issues in a child's face, you can see the growth and development issues that are the problems that are caused by mouth breathing and by other issues. And anybody that would like to have a copy of this article, they can send me an email and I'll shoot a copy of it back to you. So we also talk a lot about regeneration, especially in our older population, our healing matrix. Again, with facilitated tissue integration, it's using the lasers, the photonal laser, either the Nd:YAG or the erbium YAG. It's using PRF injections, whether it be in TMJs to help regenerate the broken down condyles. It's about learning what's good for you health-wise for nutrition, quality water, and all those things. So, our cells are a rich source of our inherent healing capabilities. They just require proper signaling to maximize the expression, and that is really true. The expression is compromised by the problems that are there, either whether they're epigenetic or genetic ones. So identifying the obstacles. You first have to identify what the obstacles are, whether it's nutrition, water quality, mouth breathing, GMOs, and the sensitivities. And today, the seed oils are so bad, the canola oil and the preservatives that are in all of our foods and the dyes that are in all our foods, and of course, sugar. All those things are important and they all influence growth and development. So we have kids that come in with enlarged tonsils or enlarged adenoids, and they're eating junk, they're eating GMOs, or they're sensitized. And so we look at, let's limit the glutens and the sugars, the seed oils, the preservatives, and see if we can't get them to start getting healthier that way. And so that is part of our interview process when we talk about the things. And we want the patients, the parents and the patients to take ownership of their problem. If they don't take ownership of the problem, then they're never going to know how to fix it or keep it healthy once they do get in a better place. And the obstacles, now we look at structurally as a dental perspective, the high vaulted palates, are narrow and they rob tongue space, and the contraction of musculars, which is not being counteracted by the tongue because the tongue is not in normal oral rest posture. So we have this biotensegrity problem. So there is no balance. We're actually using extra energy just to keep the system afloat, to keep our heads up, to keep our ability to breathe, or keep our cerebral spinal fluid flowing, keep the lymphatic drainage system working. All that stuff is important, and we need to talk about it. Of course, mouth breathing, we didn't go there, but mouth breathing leads to enhanced sensitizations. You got to get rid of those. And then in tether oral tissues, whether it be tongue ties, lip ties, buccal ties, or the fascial restrictions. And then muscular dystonia in the tongue impedes sinus drainage, impedes cerebral spinal fluid flow properly, and lymphatic drainage. And then again, looking at retained parental reflexes that can impede vision development, postural coordination, balance, gait. There's just so many things that can happen. And if no one ever knows that they're there, or they don't look through them or look for ways to help them get through that and get to a healthier spot, then it's really hard to make them healthy. So what I'm trying to explain here is that it's a process, it's a protocol. You need to go through the parts of the diet. You have to go through the exercise, the myofunctional therapy. You have to go through the integration of the tissues with the lasers. You have to get in the other parts of the retained reflexes and make those come online and do what they're supposed to do, so that person has a chance to get healthy and stay healthy. So, and then removing or shoring up these obstacles, and we remove them again with the nutritional counseling or microbiome repair, osteopathy, BT, OT, myofunctional therapy, speech therapy, ENT help, photobiomodulation for the fascial tissue restrictions, especially in the floor of the mouth and the jaw joints. And there's always stored emotional trauma. Some of the toughest cases that we have to treat, especially in adults and sometimes children too, is retained emotional trauma and getting that through. And then I already mentioned earlier about the PRF injections and the mandibular condyles. We're seeing 25 to 35% repair in those areas. Now, we're not doing cervical vertebrae because that's the orthopedist's job, but they're also seeing similar benefits. So, harnessing the tongue. This is such an important thing. It's a great article. It's called Topography and Elimination of Slow EEG Responses Related to Tongue Movements. And they show a lot of EEG changes and how the tongue touches different parts of the mouth. And when they put this glove on there and they change it around. But all these things that I have listed here: vision, hearing, breathing, lymphatic drainage, cerebrospinal fluid flow, sleep, TMJ, sinus issues, tensegrity, functional therapy, torticollis, dystonia, they're all related to how the tongue functions. If the tongue's not functioning properly, or there's haven't been enough room for it to be able to get to function properly, we got to create that. And that's what it is. Understanding that there are a lot of things that have to be addressed and made sure that they're coming online. So the facilitated tissue integration, again, we're talking about photobiomodulation. This is the University of Wisconsin, Madison, Mitch Tyler, and he's doing some studies with stimulating the tongue, and he's seeing some pretty phenomenal things happen through tongue stimulation. He talks about reprogramming the brain, but he's had patients that were blind being able to see after they stimulated the tongue with electrical stimulation. Not completely clearly, but they could see shadows. They were able to then ride a bicycle or do other things they could never do. And hearing improvement, people have seen hearing improvement by stimulating the tongue. It's just the tongue has so many nervous fiber attachments that right now we just know very little about what we can do to enhance the ability of the brain to work properly when the tongue can do what it's supposed to do properly. That means it's not tethered. That means it's the myofunctional therapy is kicked in, or the retraining of the muscular is kicked in, or the photobiomodulation for the mouth, or in the other areas in the TMJ to help release the fascia is kicking in, allowing the tongue to get more free to deal with the more things that it should be able to do or could be able to do. In quantum physics, maximizing free energy, Erwin Schrödinger, a pioneer in quantum physics, emphasized that the life tries to maximize free energy. And what free energy means, it's energy available to do useful work. Now, if you're constantly debilitated or you're constantly compromised, you're using up all your free energy. You don't have that free energy that's necessary for the body to be healthy, to continue to be healthy. So what we need to do is provide more free energy. And how do we do that? Well, providing the free energy, we're going to reboot the body's energy grid. We're unleashing trapped energy. Let's find that energy that's needed for growth and development and repair. And where is that energy trapped? Well, it's trapped in our cranial support system because the muscles are using so much energy to balance the cranium, to provide for cerebral spinal fluid flow, to help the brain drain at nighttime. But it's like it's like working double. If you think about the muscles contracting, trying to support the cranium, if the tongue had been in the floor of the mouth or in the roof of the mouth as it's supposed to be, it would be that foundation point. It would be that set point for the muscles to hit and continue back to more thorough osteopathic change, where we're getting more cerebral spinal fluid flow, we're getting more sinus drainage, we're getting more lymphatic drainage. So it's such an important thing. So just by shoring up the foundation to the cranium, and that would be with an appliance, you're going to get extra energy because the muscles aren't required to continually be in the compression state. We actually are reestablishing tensegrity so that the body has that counterbalance. So it can have the muscle contraction and the counterbalance push back out. So lasers help that. They help give us energy directly. It's a lot of articles that talk about photobiomodulation with Andy Yag and how it actually delivers energy directly to the mitochondria. So we're actually supercharging the mitochondria while we're doing part of that, following the meridians and working through the photobiomodulation programs. So this is one of those. This is Andy Yag. We're working on the tongue in a particular pattern. Erbium Yag also on the tongue and the floor of the mouth, and you can see in the roof of the mouth. We're looking at reinforced neuroplastic patterns. What we do is we'll treat the tongue, and then we'll treat the palate with the lasers, and then we'll have them swallow, and we'll do that a few times, and we're starting to see almost immediate elevation of the tongue to the roof of the mouth after we start that treatment. So it's pretty fascinating. Health improvements, removing obstacles, and providing freedom. So we're really just giving the free energy. We're giving it back to the system because we're shoring it up. We're giving the energy from the laser. But as we shore up with the appliances, as I said, and the light wire appliances are so good because not only do they shore up the cranium, they shore up the floor of the mouth, or excuse me, the roof of the mouth, and they don't take tongue space up. So in addition to holding the top of the mouth where it's supposed to be, allowing those muscles to have a set point for cranial rhythm, they they give us energy back to the system. It also helps to support the autonomic nervous system. And sometimes we see children right away calm down right when we put the appliances in place. And we see them that same night, they'll have improvements in sleep or snoring or nasal breathing or postural changes day one. And so it's way too soon to be a mechanical change, but it's definitely along the line of neuroreflexive reprogramming. And we see children that were failure to thrive start thriving. We see children that had sensory processing issues start to have fewer sensory processing issues until many of them completely disappear. We're seeing dystonias on the tongue start to improve as it starts lifting up. We're seeing bone repair happening where we're getting much more larger growth and development in the arches. If you look at those arches, and it's pretty easy to see within a few weeks or sometimes a few months, there's space growth of bone between every single tooth. Well, the appliance doesn't touch every single tooth, but the tongue does. And it's the tongue that the appliance is attracting to the space to do the job that it should have been doing in the very beginning. So one of the hallmarks, of course, is quantum coherence, which I mentioned a little bit earlier. What that means is it's exciting cells, and these excited cells have a lot of stored energy, and they like light force. This light force just releases tons of energy so that it can go ahead and help the system become more self-sufficient. This is from page 94 in the textbook Rainbow and Worm on quantum physics. And this is how the light wire functional appliance works. So what is the appliance? The light force growth guidance pediatric appliance. In my mind, it's like living, it's like gardening, it's like living gardening therapy. It becomes a biomimetic tongue because it's like a surrogate tongue in the roof of the mouth, holding the space that the tongue should have been holding so that the cerebral spinal fluid can flow better, so that the cranium can get better, stronger cerebral spinal fluid flow, and also gets a better lymphatic drainage. It's basically restoring tensegrity in the system via the counterbalance. We're seeing new reflexive responses, as I said earlier, but we're seeing subtle changes. The sensory input to the palate allows the autonomic nervous system to kick in many times, allows nasal breathing to start happening many times directly, and it allows snoring to stop many times within the same day. Bedwetting, we can see bedwetting start. It's thumb sucking. Just other issues that are there that we see improve sometimes in the same day as the appliances are placed. And we're helping the genetic expression through mechanical transduction, which actually is pressure on the palate. And it works as a malfunction trainer in the sense that the tongue is not inhibited from going to the roof of the mouth, but it's encouraged to go to the roof of the mouth by the position, the placement, and the size of the omega loops that are there. So we're getting encouragement in proper arch development. In my opinion and understanding, that this is the only appliance, light wire functional appliances, are the only ones that can do that. Everything else robs tongue space. Everyone else gets in the way. Everyone else is very rigid. These are very, very pliable. They're very light wires. It's very, very flexible. It's a dynamic wire. It holds its flexibility for a very long time. Kind of looks like this. This is a pediatric case. It's probably one of the most famous pediatric cases because if you look around at websites that are showing an alpha appliance, this one shows up a lot. And the reason we know that this one is the one it is because it has a little blue articulating ribbon spot where there's a little bit of composite there. So if you look through the websites of people that say that they work with functional appliances, with light wire functional appliances, and you'll likely find this one many times. And this is one of ours because this is one of my patients. And we talk about it being a facilitator. And that's really what it is. It facilitates the body's ability to recover. It facilitates the regenerative potential because it's holding the cranium up, basically. And the flexibility in the wire is causing slight tension factors, which reestablishes tensegrity so that we have that balance. We're getting growth between the teeth, as I mentioned earlier, everywhere. So it's a pretty versatile appliance, and it's so innocuous. Most children have no problem whatsoever wearing it, or adults for that matter, because it's so small and it doesn't get away. And we leave it in 24/7. We actually glue it in place, and we tell the patient not to remove them, and we have them work with water picks to keep it clean. And I've had several dentists come to take our program at AEI, because they had sent children to us to be treated. And even though we leave the wires in place sometimes for several years as they're going through mixed dentition or changing things out or as retainers, but they don't get cavities. They very seldom get decay in the teeth. And so they come to see why. How come these kids don't get cavities? But the reason that they don't get cavities, two reasons. First is, as the arch develops, there is space between all the teeth, so it's easier to keep them clean. And secondly, most of them become nasal breathers, and we work on that so that they're breathing through their nose, so they're not drying out the tissues, they're not drying out the enamel, so that it's more susceptible to caries. And also, we talk about nutrition. We try to get them to eliminate sugar and minimize it, to minimize the gluten and the things that stick there to make the teeth get decay. So it's kind of multifactorial, like everything else. But once the patient learns to take ownership for the problem, then they start to take ownership for the development and the repair and the regenerative health also. So here's one case. This is about 10 months from the left side to the right side. And you can see as each developmental time frame that we see them, we'll make a slight adjustment in the anterior loop. We can see that the posterior loops didn't get much, if any, adjustment, but the anterior loop got considerable. And you can see how the roof of the mouth has changed in shape. And we're getting nice arch size. So when we talk about development or goals for our patients, for our kids, especially the 2, 3, 4, 5-year-olds, our goal is to create age-appropriate growth. We want to see spaces between all the teeth. We want to see the shape of and size of the palate large enough so that the tongue fits there. If the tongue fits there and we encourage the tongue to go there, the tongue goes there. And once they start getting that normal oral rest posture, that becomes the stabilizing force, that becomes the retainer over time. And then this is I'm going to pull this down. This is a couple of cases that we started. This is before we did the growth guidance therapy. And this is afterwards. Same girl, before and after. She had neck aches. Is this a surprise to anybody? Her dad's an acupuncturist, and he treated her a lot to keep the headaches and the neck aches away. But after we went through the growth guidance process of interceptive treatment, then she was no longer having neck aches. This is another little girl we treated. She was one of our first mini residency program kids that we treated, and she was autistic. She had severe meltdowns, processing disorders, and within 3 months, most of those had disappeared. I have a great video I'd love to show you, but unfortunately, it's not playing just quite right for me right now. But I will have it on my website so you can look into it and see it. But it's the mom explaining how she'd gone through several years of autistic treatment. She could only eat 8 foods when we first started treating her. She had very poor coordination balance. She couldn't go to school because she was very belligerent. She would beat up on the other kids. She had 2 younger siblings that she would beat up on regularly. And when she came back for the first visit after we started the program, which was 3 months later, in mini residency, the grandfather came because he wanted to meet us, because he wanted to know what we had done to give him his granddaughter back. He said to me, and I have it on video, that he thought they were going to have to institutionalize her. She could not deal with her beating up the younger kids. She couldn't go to school. But when she came back in 3 months for the second visit in the mini residency program, she came back and she was doing cartwheels in my hallway. And this is a girl that couldn't ride a bicycle. She had very poor coordination and balance. And 3 months later, she's doing cartwheels in my office, which she was really proud of herself. And I was proud of her too, because it was just a tremendous change. This is her when we started at 8 years old. And this is a little bit of her history: normal uneventful pregnancy, rapid labor and delivery, breastfed, aggressive feeding, but failure to thrive. Severe fine motor problems until 5 years old. She was gagging with pills. Delayed vaccination schedule, but at 4 years old, she had a severe reaction to a DTaP. High-pitched sound, she screamed and slept for 30 hours. She had eye surgery for autism regression, shortened the muscles, had anaphylaxis to anesthesia. She used a pacifier for 2.5 years. Often was nauseated, gasped, and constipation. She would wake up 2 times per night. She had a very high vaulted palate, heavy lingual frenum. But she would, her mom would have to actually shake her because she would wake up screaming in the middle of the night. But she wasn't awake, but she was sleepwalking and screaming. And her mom would shake her to get her out of that every single night. And she would have meltdowns every single day. And I'm not going to replay that one because it discusses the appliance a little differently. But I'd be happy to show it to anybody that wants to contact me. This is her 9 years later. She ended up getting the award for the most congenial student in her class the year after she started the treatment with the light bar. She's now you can see how beautiful her bite is, her occlusion is, and her teeth are, and her face is, and how symmetric it is. And she only had the light wire treatment. She didn't have anything else. She had early until about 11 years old, and then now she was 8 in the first one, and so 9 years later, so she's now 17. Successful young lady, plays in the band, plays on stage. She was introverted before. Just her whole life changed. It was life-changing for her. And this is her arch, if you can see the two. And this is 9 years later. This is without retention. This is growth. This is getting the tongue to do what it's supposed to do. This is creating a size and shape of a palate that's proper for the patient. But we didn't do it. The appliance didn't do it. The tongue did it. And it was really about harnessing the tongue, as I was saying earlier. Tongue is a remarkable muscle, or not just a muscle. There are several of them there, but it can do tremendous things. And this is Mia again. Oh, sorry. We never did the differentiectomy, but we did do photobiomodulation, working on the floor of the mouth, helping her stretch through things. And so she ended up, you can still see her, that she has had no crowding of the lower anterior or the upper. So she's got some degree of tensegrity stability. This is Clea. Clea was our youngest patient that we ever started treating at one time. I started treating her at 2 years and 8 months old. And then the next patient that I treated younger than her was her sister. And she had a younger sibling. We started treating 2 years and 6 months. She was very hot, narrow palate, significant overbite, receded jawline. She never breastfed. She never nursed. Was diagnosed failure to thrive. That's her life before growth guidance. When they relaxed state, their mouth did not close. It was always open. She also had a strong tongue. She couldn't understand her speech. She only, mom said, 50% of her speech was understandable. And look at this. This is from July 2012 to May 2013. This wasn't yesterday, folks. This was 12 years ago. And this is a 2-year-old, well, 3-year-old. We were treating 3-year-olds 12 years ago. So when people talk about early intervention now, they still, they're trying to catch up. And it's good. I'm primarily happy for them. So proud of everyone that's come step forward, especially what Lauren has done with Airway Health, getting people to look and let's treat kids before 6. But I'm actually honest. We should be treating kids in toddlers, and maybe even at delivery if we can. But you can see, look at the arch, the width, the age appropriate, or maybe even slightly more than age appropriate. Look at the spaces between all the teeth. And how about the gummy smile? Look how the gummy smile is. And again, here's the year and a half of wearing the alpha plant of the light wire functional appliance. Um, and tremendous development. This is a picture again. You can see, look at her smile. Look where it was, look where it is. This is less than 2 years, a year and a half. Mom said she's made significant improvements in both breathing and speech. Her speech is much easier to understand. Over 80% of her speech can be understood. She's also able to close her mouth with ease and notice that she's in a relaxed state, her lips are touching. She's breathing through her nose much more than before. I've also noticed that her energy levels have improved. This is Mom. This is another 2-year-old that we treated. Same thing, same idea. She's 2 years old. When she came in, you can see how small she is. She was failure to thrive. Again, these are initial pictures. It's tough to take pictures of a 3-year-old. We didn't do a CBCT of her. We normally do that. You can see how small the airway space is here, the large adenoids are. So in these cases, when it's very little child, where it's not going to likely to stay stable while we're taking the CBCT, we'll just do a scout film. And so this is like taking a scout film. But you can see where she was. She was thumb sucker. It stopped right away after we put the appliance in. You can see it here. This is how narrow the arch was. Look how deep the palate is here. And this is as we're starting to treat it. It's lower. You can see the spaces down on the lower, but that's where the tongue always lives. So it was not a problem with space on the bottom, but the tongue never went to the roof of the mouth. And now we can see her. This is 6 months. 6 months of growth guidance. Look at that palate. Look at this shape of it here. 6 months previous. Look at now. She's sleeping better. She's nasal breathing. She stopped sucking her thumb. And this is another patient. We started as 5-year-old. Let's do some pictures here so we can have some time to have a couple of questions here. This is how her bite developed over time. This is look at her midline is on, even though we're still in mixed dentition, but you can see how nice and wide it is. In this particular case, first thing the mom noticed was that her handwriting improved. Like within days of getting the appliance in place, she could actually write in cursive. Prior to that, she couldn't. She didn't have the balance and coordination necessary to do it. And within days, she was able to do that. That was the first thing her mom said to me. This is incredible to me. Mom's an osteopath also, so she was getting osteopathic treatment. So, and then this is just some other uses of the appliance as we get into older kids, and you get blocked out bicuspid here, created the space for the blocked out bicuspid, and then brought it in place with brackets to finish. This is a child with a deep overbite, and you can see how the mandible shifted forward, and you can also see where this posture got significantly better. This is not with a Herbst appliance, and it's not with a mandibular advancement appliance. This is actually the body's doing its own job as it was allowed to catch up to where it should have been. This is 5 months treatment with the growth guidance appliance. She was class 3. And in 5 months, she jumped the anterior teeth. Faces symmetry of the cover. Her head tilt changed. This is a little gross. This is just one of the more fascinating set of pictures I've ever taken. In September 2007, you can see what her posture was like. And then April 2008, she wore the same dress to come in for the treatment, and you can see how her posture changed. And I think that is just a dramatic change to see in anybody. Can you imagine what her neck is like, or would have been like, or was like? And then this is another little girl, and this is between July 2012 and I think August of 2013. And look at after the crossbite was fixed. Look at her beautiful smile. Look at how her neck got straight. Look at how the balance in her face got to become normal. These are life-changing treatments, and it's all about allowing the bones and muscles to get to where they need to go, and allowing the tongue to do the job it's supposed to do. This is another case. Look how much wider she is. This is a 5-year-old, also belligerent. She was not allowed to go back to school until after we did treatment, and totally changed. Look how narrow she was. Look how the overbite that she had, or the gummy smile that she had. And this is only this is from August of 2012 and April of 2013. So it's like not much time. We've got a really nice arch development, age appropriate arch development. But look at her face too, the profile. Look at her lips are closed. She's breathing through her nose now. Look where the tongue used to be. Where the tongue used to be here. Look at this. Now look at this. This is pretty impactful stuff. And her whole life changed. She went from being the worst kid in school to being one of the best. The little boy, same thing. Look at his face. Look at the grimace. Oh, he's biting hard here. He's got this head tip here. Now it's balanced out. He had a crossbite. Look at the crossbite. You can see the crossbite. And this is in February 2011. And then this is September 2012. So a year and a half. Crossbites changed. Look at the spacing, age appropriate arch size. This is a 4-year-old thumb sucker. We made a light wire appliance that had a bead on. This is 2013, I believe. He stopped drooling and sucking his thumb the first month this appliance was placed. And you can see here from 2013 to 2014, a little over a year. Look at the age appropriate development. You can see even the maxilla is a little further than we'd like to see. And so we need to get the mandible out, but this is plenty of room for his tongue. You can see the bites closing down. You can see his tongue is up in the roof of the mouth. This is a posture and neck change. Check this out from September 2013, July 2014. Level head, facial symmetry, smile changed. Cuspids that were blocked out are now dropping into place. Profile, same thing. This is showing the regenerative potential of ossific remodeling. This patient had a completely blocked out lateral incisor, and in 6 months, we went from being completely blocked out to having space here to work it in with a light wire appliance. And then we also included bracketing at the same time and brought the whole thing in. And then this was at 18 months. This young lady came to see me. She had not gone to school since she was in the 9th grade, and now she's 16 years old. She couldn't get out of bed in the morning. She was exhausted. Her parents took her to Paracelsus Clinic in Switzerland. They thought that she had Lyme's disease. She was getting all kinds of treatment. She was having orthodontics at the time. And when I met, actually, this is the mom that I met at Jerry Tennant's office, because she came to ask me what I really did when I said I was the elf dentist from North Pole. And she said, "Can you think you can treat my daughter?" And I said, "Well, does your daughter look like you?" And she said, "What do you mean?" I said, "Well, does she have the same tongue that you do?" And she said, I don't know what her tongue looks like. So, well, does she have the same teeth that you do? She said, "No, my daughter has beautiful teeth. She's just about finishing braces." So then I said, "Well, how long has she had braces?" Then she looks at me and said, I don't know. How long did she have braces? And she had braces put on 3 months before she got sick. And I'm not sure why someone didn't think to at least take the wires out of the brackets for a little while to see if it would help. But in any event, when she came, we put her on light wire functional appliances, and this is how her face changed from December of 2012 to February of I think it's 2013. But look at how it was pointed, and now it's nice and rounded, how it's smoothed out. These are her own pictures. She took the pictures herself. But what is most impressive to her is she said her hair grew 3 inches in 3 weeks, which is from this point, because she dyed it to show me. She said, "You don't understand what that means." And I said, "Okay, you're right. I don't really know what that means." She said, "No, I've gone for 3 years and not had a haircut. My hair was not growing. And now since we put the appliances in, my hair has grown 3 inches in 3 weeks." So it helps the entire system. The hormone system kicked in for her. It took a year for her to get healthier and to get back to school. And she went to college. She went and got her GRE, and then she went to college. When I talked to orthodontist, he actually asked me what I did. I sent him the original pictures and the pictures that I had when we finished. And he said, "I don't see a lot of difference between where the teeth are here, or that you just finished, and where they were when I did it." And I said, "But what's her airway look like?" And he said, "Well, it's definitely bigger." And I said, "Well, what about her neck?" He said, "Yeah, well, it definitely has a better curve." And so what happened there is that then he went out and bought a CBCT and started taking scans of patients and watching Airway. So he became Airway focused orthodontist. from this case. Nice guy. He was really inquisitive because he wanted to know what we were doing was different and how she got better. And I'm done in a minute here. Let me just, this is a 73-year-old. Look at the posture. Look at this posture. How do you change a 73-year-old's posture? You balance them. You get their occlusion balanced. You get the tongue up in the roof of the mouth. You teach them how to breathe through their nose. This is one of my favorite cases. This is the same patient, and it's a year and a half later. You can see how the cranium changed completely from being discombobulated and sideways to being right on line. This is her airway, the same thing. You can see how her jaw almost looks like we picked up her head and put it back on her vertebrae in a different place. You can see on the left-hand side where the vertebrae are very, very straight, and the right-hand side actually has a lordosis. The airway's bigger, but this is even more telltale. This is how the occiput sits on the cervical vertebrae from one time to the next. And she had TMJ problems. She had all kinds of issues. She was equestrian, had all kinds of problems, and they all disappeared. Literally all went away. And I want to show these. These are the two pictures that I just showed you. But the blue is the current position of the bones, and the white was the previous position of the bones. I used to think that the bones were remodeling, but they're not. They're just changing position. So they're working along the suture lines to reposition themselves, which is pretty phenomenal. And now we do this with every case, and we can see exactly what's happening with the realignment of the cranial bones. It's pretty fascinating. Again, blue is new and white is old. This is just a quick look. This is our level 3 regen patients. Look at her face on the left-hand side and on the right hand. She's wider, she's smiling. How about the wrinkles? And this was facial symmetry, and this is way before we were doing any of the laser stuff. And this lady, she was a TMJ case, and she came to wearing a splint, and her bite was like on this side over here. That's how she came in, and this is how he got her to have to went through osteopathy and light wire functional treatment and balancing the rest of her system. And I want to talk about this book real quick. This is book. And it has a lot of good stuff in it about how things work. And I just wanted to just plug her book for her. It's a great book, and it's one of the better ones that are done. And I want to talk about shape memory right here. I'm closing this up. This is what we're doing now. These are aligners. This is a liner. You put it in hot water, and you can actually bend it in and shape it and put it in. And then you actually can put it in the patient's mouth, and it's soft and it's easy and it fits nicely. And as it hardens, it becomes a regular type of liner. So it's the wave of the future. And then I'm going to program on growth guidance if anyone's interested. I have the QR code up here. And the present that I'm going to give you, our normal price for the course is $29.50. And for the first 25 people to sign up from this program, get it for 50% off. And you just have to write ELF so that I know that it came from this program. And then we have a full mini residency program that starts. Well, that's actually my TMJ program. So we're doing PRF injections and helping rehabilitate the condyles. We're getting 25 to 35% regrowth of the condyles, which is phenomenal. And so we're doing one in June and one in October. And this is our full mini residency. So if you can do the barcode, you got it. If you don't, you can look at the websites. And that's it. Thank you very much.
Wow, Dr. Bronson, thank you so much. And I'm glad we gave you the platform because there were so many questions that you actually answered by showing a lot of the cases. And I know there were a lot of questions. And if I may, can I email those to you?
Sure.
Because I know you're really receptive and helpful, so we can answer those questions that we didn't have a chance to get to the Q&A. But I thought it was just fascinating to see the change. And I love how we're all into early integration, taming the tongue. Did I cut out here? No, there we
No,
are.
I'm
Taming,
not
yeah, taming the tongue, nasal breathing, these co-therapies. I mean, we're all in the same boat together. It's just a matter of different techniques and strategies. So we really appreciate you taking the time to share what's been working for you over these years and many other people. And is there a website or a contact that you can actually share again?
Yeah, you can, it's director at quantumelf.com.
Say that again.
Director at quantumelf.com.
Perfect. Thank you. And I just want to share some upcoming events that's coming up with Airway Health Solutions. We do have our summer special, and I just wanted to let's see. You share, hold on. You have to stop sharing.
Go ahead, it's fine, it's fine.
Yeah, hold on 1 second. What? Well, I'll talk about it. We have our summer special, and you can go to our website. It's airwayhealthsolutions.com and learn about our upcoming events. We are doing our courses on demand at a discount for our summer semester, which is June through September. So maybe you want to take advantage of that and learn more about our free education that we offer on our Airway Health Solutions conversations. They are all archived, and we encourage you to share them with your colleagues because you learn so much from all these experts like we just did from Dr. Bronson today. So I'm going to go ahead since we're at the top of the hour. I'm glad we got to hear everything that you had to offer us today. And I know you'll help us with any questions that are asked, and we will send up the follow-up emails with the information that you shared tonight. Is there anything else you want to say before we close out, Dr. Bronson?
No, perfect. Thank you so much for giving me the opportunity to show the stuff, because it's so important that everyone realizes that there are other things out there that we can do. And it really is it's about a team approach. It's about an integrative approach, and it's about helping people get healthier.
We're in this together. So stronger together, everybody. Learn as much as you can, and let's help these kiddos. And we can prevent a lot of these things from happening in the future. So thanks again for your passion, and we'll keep showing up just as long as you do. Thanks, everyone. Have a great night.
Thanks, Lauren.
Bye.